this is Dr. Alexandra Mackey with Louisville Hernia and General Surgery. The holidays just passed, and I got to see a lot of family members, and it prompted a few conversations that I think warrant a video. I think people tend to brush things off for themselves, especially around the holidays. And so a couple conversations I had about like bowel movements. Nobody wants to talk about this stuff, but I actually think it's pretty important. A couple things that I think are useful to know. You should be having a bowel movement every day or every other day. If you're not, you probably need to increase your fiber, increase your water. If that's still not working, maybe get a conversation going with your primary care. A couple other reasons, things to watch out for if you have a family history, especially with like a young parent. If you have a dad or a mom in their 50s that had colon cancer, you're going to need a colonoscopy 10 years before your primary relative who had it. So like, let's say they're in their 40s. In your 30s, you should start getting screened. And that's with colonoscopy, not with one of the box tests like Cologuard or a fecal Hemocold test. A couple other things. Blood in the stool is never normal. So I cannot tell you how many times people have come into my office and said, oh, I just have hemorrhoids. And then we do a digital rectal exam, and it's unfortunately not a hemorrhoid. It's actually a rectal mass. So if you have bleeding in your stool, it may be hemorrhoids. It may be an anal fissure. There are plenty of benign reasons for bleeding in the stool, but you should have that investigated by a professional before we write it off as hemorrhoids. A digital rectal exam is often skipped in a lot of appointments now. It's a really important part of the clinical exam, especially if you're having bleeding. I do think colonoscopy is really beneficial for people, and people get very weirded out about having to even do the prep. So I thought I could tell you guys a little bit about bowel preps and how they work and what would be helpful. And I'll do that in my next video. And hopefully can give you some of these pro tips that I personally have used and I think have helped a lot of patients. If you need any help with colonoscopy or any other general surgery problem, gallbladders, hernias, feel free to call us. It's Louisville Hernia and General Surgery. It's 502-439-6180. I hope you guys have a great day.